You must remodulate or revascularizate two discostal fragments. You must cut this pseudoarthritis. You must understand that if you cut this pseudoarthritis and you cut this bone tissue, what's happened with the bone, with the tibia? The tibia starts to see shortening than other because we have a deficit of the bony tissue. How we treat this patient? We take off all of this metal construction, and it's happened, I forgot how much time ago, and we use the extramedullary fixation by apparatus Elizarov, and the patient spent another 2 years into this apparatus. Why? Because he had a deficit near than 3.5 centimeter after cutting off this pseudoarthritis. And I told you that if you want to grow 2 centimeters of new bone tissue, you need 1 year. That's why maybe like this, the general mistake, doctors, because they non-take off any of the screws, patient's decision that he or she so afraid to stand on this extremity, guaranteed that the patient need another long period of treatment. And sometimes the results of this treatment is not so well. Why? Because so long period of metal construction presented into our patient's body guaranteed that some purulent problems starts. And the purulent problems, which kinds of them? Osteomyelitis. That's why so simple, maybe primary situation when we speak about the closed transverse fracture of the tibia, finishing by 3 or 4 years of hard treatment. And these things depending by the small cells which present into the bones, and if the doctors and the patients forgot that the bones is not a stones. Thank you so much.
Thank you, doctor.
You understand me? 40,
Yes, sir.
46 minutes, short lesson, lecture, yeah?
Sir, I have a curiosity. Can we use bone cement to I don't know, decrease the...
Yeah, I understand you. If you have a deficit of the bone tissue, more simply, and if you made some sausage from the bone cement, insert there and that's all. But I told you about the third phase of bone regeneration. It's a new angiogenesis. And the bone cement, it's so, how we named it, it's so steel material. And we don't see any bony... One second, I forgot this term in Russia too. Bony implantation. And that's why if we want to cut some part of this bone and insert here the just bone cement, we must fix it by some external metal fixation apparatus. When we take off, we have a fracture on the line when the bone cement connect with the normally bone tissue. Other situation, more better if we insert the outer bone of this patient. When we can take some parts, usually we use this from the rings of pelvis, insert here, and we do this for this patient. But I think that you agree with me, we have not too much of non-needed bone tissue in our body. And if you want to cut 3 centimeters of this bone, and nor does it mean that bone implantation happening full here. If you have a cavity anywhere, you can cover it or maybe close this cavity by the bone cement. If you need a layer of bones, sorry, no.
Thank you,
Answer
it. Yes, I understood. Thank you.
Any questions?
No, sir.
That's why I forgot. You're a 10th semester students, yeah?
9.
9. Okay. That's why somebody of you present on our lessons here in the next semester, and see you in the summer session.
See you, sir.
Have a nice evening, students.
Thank you.